All right, we're talking about matters health and how close it is, because the primary health is where a majority of Kenyans depend on first.
Yeah. When first is to develop level 1 and level 2 hospitals or facilities, dispensaries and health centers. Some health centers are level 3. At that point in time, we really rely on community health workers.
Yes.
These are civilians, mainly women, but some are men, who are trained in basic health care, particularly family health. Family health means that a community health worker must have a record of families in this family, in their area of jurisdiction. It is a long-term process because it is not something you force on people. It's something you persuade people to join so that the public health system can help them prevent some diseases through vaccination. Now, you know that we usually think of vaccination only in terms of pandemics. No. Vaccination should be something that is undertaken in terms of prevention of possible diseases. I'll give you an example. Young girls entering puberty.
Yes.
And not yet experiencing sexual contact with boys or men. Now, they must be taught how to take care of themselves, particularly when they begin having their menstrual monthly periods. Okay. There is something called human papilloma virus, which girls and women get. That human papilloma virus, it can be vaccinated against because it is a precursor to possible cervical cancer. Now, this is something that only community health workers who are women can do in educating families about vaccinating young girls against human papilloma virus. Now, at the moment, it's a very serious matter because teenage pregnancy is becoming very prevalent in Kenya and interferes with girls' education. Recently, when we were giving scholarships in Tom Mboya Labour College, bursaries and scholarship, Kenya Commercial Bank, I was shocked to find a girl who was getting a scholarship to go to high school, who was 11 years old and had already had a child. You understand this is a very serious matter.
Yeah.
So we as county governments have an enormous responsibility to deal with this kind of thing, let alone dealing with things like HIV, AIDS and so on, and non-communicable diseases like cancers and so on. There are some basic public health and family health issues that we must confront.
Absolutely.
You see. And that is why when we in the county government said that we should get enough money that we need from the revenue bill, okay, the CRA. I mean, it is not because we want to misuse that money, it's because that money is needed for very basic health care provision in our society.